Hello everyone. You're looking at a panoramic radiograph of a 16-year-old Hispanic male. First thing that you should recognize is there is an opacity almost at the level of the hard palate. And when you start counting the tooth number, you will quickly realize that this is an impacted canine. So yes, you've determined that. So here we have an impacted canine. But the reason I'm making this video today is this radiographic appearance of the maxillary and mandibular molar. Compare that to the right and left. Something looks very unusual, isn't it? That root morphology is very interesting, just affecting the upper and lower first molar and left side only. So what could be the possible explanation for this area? It's a little blurry here. The pupil space becomes a little blurry and becomes sharp again. And here it just has that band of area that looks blurry. So what could be the reason? I don't think I had a chance to cover this in some of my lectures, so I think it would be important for you to see that and recognize. Well, one of the options could be that this patient has unusual root morphology, right? So that could be one option. Or some of you may consider there's a rotation of the patient head, because as you know, if the patient has rotated, one side of the jaw appears wider, whereas the other side of the jaw appears constricted. But looking at the mesiodistal distance of these molars, it still doesn't explain why a single molar is wider. If this side is widened as a result of rotation, I would expect second molar and third molar as well as the width of the ramus should be wide as well. However, that's not the case. As a matter of fact, if second molar number 31 looks wider to me than mesiodistal distance of number 18. So then what could possibly be the explanation of this appearance? Could this be just anatomic morphology? Or could this be a tooth with two separate crowns? Or is this just very unusual positioning error? Well, to give you a little bit more clue or determine what this is, you have to look at what's occurring to this area. Right now, there's a kind of this, like a step deformity, very minor step deformity along the inferior cortex of the mandible. And if you can see that this area coincides with this area and then this area, and even though it's not as clear, it probably affects all of this area. So now I've given you a big clue of what this most likely represents. So in this case, we're probably looking at patient's motion related artifact. So motion artifact, patient moved as the source of the X-ray was going around to image this site. Obviously the cause of the motion is unknown, whether that equipment may have hit the patient's shoulder or patient may simply just moved. So I don't know, but this is an example of patient's movement. I hope you found this to be interesting. This is a unique, kind of atypical artifact we normally see at our clinic because we do such a great job of making sure patient does not move during the scan. But this was an image that was imported from the outside. At the same time, I want to show you lateral ceph just to again demonstrate the position of the impacted canine. So the canine is horizontally impacted at this point, and you can see the developing follicles of the third molar. right, it is unclear to clearly visualize the root morphology of the mandibular force molar. Um, so I can't tell, but I would presume that the root morphology would be normal in this area. Anyway, that's it for me, and I'll see you in the next video. Take care.